The InsielMercato solution for the social and healthcare information system is an integrated system that meets all the needs of the health service providers and covers the clinical, territorial, access, administrative and management, and government areas with shared databases and rationalized automated processes. It is a comprehensive solution which is integrated. The information resides in centralized stores accessed by the applications. Interoperational. It supports communications with other systems using various standards. Effective. It has a web-based architecture. Secure. It guarantees the security of systems and the confidentiality of patient data. And multi-channel. Data can be accessed through a portal, PDA, or other equipment. To illustrate the advantages to a patient being cared for in a hospital with an integrated IT system, we have imagined treatment that envisages various procedures, including an operation and a blood transfusion. The software solutions developed by InsielMercato that the patient encounters during the process will be highlighted. We can assume initially that the patient's family doctor has prescribed a series of outpatient services. The doctor makes his or her appointments through the Central Appointments Office, CUP, according to need and availability. The Appointments Office coordinates all functions to book the necessary services and supports all health structures in planning activities. Working plans and waiting lists can be drawn up and managed, taking the type of patient and characteristics of the request into consideration. At the appropriate date and time, the patient goes to the clinic, which may be inside the hospital or in separate premises. The InsielMercato outpatient management solution manages the clinical and administrative data, booking other services if necessary, and providing the support to manage the process according to the instructions of the medical staff. It can also be used to prepare relevant reports, compiling the specialist outpatient file, for example. Following the outpatient examination, the patient needs to be admitted to hospital. At this stage, the pre-admission tests can be requested by the outpatient clinic, and the admission and operation can be added to the waiting list using the ADT system, Admission, Discharge and Transfers. The ADT system supports the entire administrative process for conventional admissions or day hospital treatment. In addition, the patient wears a wristband containing their data in barcode or RFID form, which cannot be modified and which minimizes possible identification errors during the various procedures. Before and during admission, the patient must undergo a number of preoperative tests. Order entry functions are available, which make it possible to submit requests to the departments providing the services and to receive replies. In the department, Medical Records Management provides all the information about the patient's admission, from diagnosis to discharge letter, creating the conditions for paperless management of the file, including electronic signature of the documents and arrangements for an alternative form of storage. The file can be personalized by individual departments and can include the activities of medical and nursing staff. During treatment, correct management of any instructions and subsequent medication is vital for medical and nursing staff. Data is entered right at the patient's bedside using an optical pen and a tablet PC. The care plan and medication plan provides a precise picture of the care prescribed for the patient, which can include drugs, diet, and welfare activities. The medication plan manages the progress and completion of the nursing activities, noting the administration of drugs and monitoring the execution of any procedures. Interaction between the care and medication systems and the department's stores makes it possible to manage requests for drugs, configuring stocks and dispensing them by scanning the barcode on a portable terminal. The patient's operation can be managed by the system's operating theatre function, which deals with entry on the waiting lists, programming of the necessary materials equipment, preparing the anesthesiology file, describing the procedure, monitoring of intake, and post-operative care. A blood transfusion is needed during the operation, for which it is essential to guarantee maximum security. EMONET, the solution proposed by INSIEL for the comprehensive management of transfusion services, allows the transfusion process to be tracked from start to finish. Several errors can occur during transfusions: test tube mix-up, incorrect identification of blood group, labeling errors, incorrect distribution of units, and incorrect administration. The system incorporates functions to prevent these errors and to manage the transfusion request, supported by compatibility tests before administration. Before the transfusion, the system verifies the correct assignment by checking the identity of the patient against the bag to be transfused using a PDA that incorporates a barcode scanner. If the data does not match, an error message appears and the transfusion cannot go ahead. At the end, the details of the transfusion are recorded and any reactions noted. The patient responds well to the treatment and is finally ready to leave hospital. The ADT system supplements the functions that manage the clinical discharge data. A display of the lists of released patients can be produced. A chronological list of all the stages of an admission can be drafted. The patient's discharge can be registered and a discharge form can be produced in the department. The patient leaves the hospital, but it is important to manage the post-operative care instructions as well as the discharge plan. The care plan for outpatients, which can be activated from the medical and outpatient records, allows the hospital medical staff to fill in the request for drug prescriptions or treatment. The system is able to produce different types of prescriptions. The prescription is simplified by the availability of files that can be configured by each operating unit with the most frequently requested drugs and services. The patient's medical history can be reconstructed thanks to the clinical repository that gives access to structured information and documents made available by external systems, to trace all access to the documents and to update a patient's personal health dossier, FASP.